Hello, everyone. Welcome to Nova Southeastern University's South Florida Geriatric Workforce Enhancement Program podcast, also known as the South Florida GWEP podcast. We are here to educate, encourage, and enhance our knowledge and skills, and promote all those amazing health professions experts working with the elderly, including caregivers and interprofessional teams. My name is Dr. Hadi Masri, and I'm an associate professor at Karan C. Patel College of Osteopathic Medicine at Nova Southeastern University, as well as a geriatrician and a subject matter expert for the South Florida Geriatric Workforce Enhancement Program. In today's episode, we are taking an in-depth look at telehealth and telemedicine amongst the elderly population with our subject matter expert, Dr. Stephen Bronsburg. Dr. Bronsburg is an associate professor, director of the Master of Science in Health Informatics, Department of Health Informatics, Dr. Karan C. Patel of Osteopathic Medicine, Nova Southeastern University. He is a board member for the South Florida Healthcare Information and Management Systems Society. He is a peer reviewer for the Commission on Accreditation for Health Informatics and Information Management, and chair of the Bachelor's Education Committee for the American Medical Informatics Association. He has conducted independent research as well as collaborated on numerous health informatics research projects with health professions and students. His research interests include health informatics in the areas mobile health technologies as interventions addressing chronic disease and addiction, as well as health informatics education. His scholarly work includes national and international publication in peer-reviewed journals, conferences, presentations, panels, posters, textbook chapters, and textbook editing. Hello, Dr. Bronsburg. It's a pleasure to welcome you to our South Florida GWEP podcast, and I wanted to thank you for your time and your expertise.
Hello, Dr. Massey. How are you? I want to thank you very much for that generous introduction. It's great to meet you. I am excited to be here today and discuss health informatics technology, specifically telemedicine, and our senior population. I've listened to a lot of podcasts that have been produced by the project. I'm very impressed, very happy to see one of my colleagues, Dr. Eric Ilyaev, who also happens to be in this space that I'm in, and I'm really looking forward to this interview.
Okay, so I have a few questions for you. Tell us why telehealth, telemedicine are important to you, and how has your experience been in training healthcare professionals and students?
This is a great first question. I've worked in and around healthcare most of my working life. I started working in my teens for my mother's nursing registry and later on with her home health agency. I played a major role in the digitalization of both of those organizations, if you will. Later, I worked as a nutrition counselor. Problems that stood out back then are still accurate today. They are still problems that we're dealing with, and that's access to care, efficiency, monitoring patients, and data management.
What is the difference between telehealth and telemedicine? We usually hear those words. Are they interchangeable, or is there differences in those two terms?
That's another great question. Yes, there is, and both of them are used interchangeably. However, there truly is a difference. Telehealth is really a broad term, okay? It includes not only clinical services, but also non-clinical services such as administration, health education, meetings, trainings, and this is accomplished by the utilization of communication technologies that support these activities. Telemedicine, on the other hand, is a bit more focused on those clinical diagnostic services and treatments by a healthcare professional and or profession using telecommunications technology. This may include clinical exams, treatments, planning, virtual doctor visits, remote patient monitoring, as well as digital prescriptions.
Okay, so from what I'm getting is when you have a physician, or should I say clinician, to a patient, it's more of a telemedicine? Is it more telemedicine?
Correct. That direct care with a provider to a patient is telemedicine.
Oh, interesting.
Telehealth is kind of like that umbrella, if you can picture, and everything kind of fits underneath that, like teledermatology, telemedicine.
And communications, I would imagine, between non-clinicians also, I would imagine. Is that
Yes.
telehealth as well? Okay. That's really interesting. Okay. Sometimes we just let those terms just fly by and we don't really know the details and the nuances to them. My next question is, what are the challenges or issues we are facing with telemedicine and our seniors?
The challenges that we face with our seniors in telemedicine services are access to care. How are they accessing care? Are they accessing care with a provider or healthcare professional that actually uses telemedicine or remote patient monitoring devices? And we'll talk a little bit about remote patient monitoring devices since I brought it up. And these are things that actually capture data and information. They could be wearable or implantables. We can look at stuff like tracking blood glucose, blood pressure. It could even be implantables and such stuff as like bio-ingestible sensors or capsules or smart pills that actually capture data as well.
Right.
There's a couple of other issues that we're dealing here with, or challenges, if you will, with the senior citizens as well. There's a digital divide, and that's that economic circumstance, if you will, and that plays a major role in that as well. For limiting factors, there's cognitive decline, sensory impairment, physical limitations can all be contributing factors, making it challenging for older adults with telemedicine. Chronic conditions, comorbidities, social isolation, all add to the challenge of success with telemedicine usage. And finally, I guess the other category I would mention that I think is important is caregiver involvement. It's really critical to have caregiver involvement working with elderly patients to be able to make that a success, that telemedicine experience a success for them.
And even in this snapshot of time, 2024, we're still having trouble with our advanced population just being introduced into telemedicine and setting up that device for them. It's a little difficult for them as well. They do get used to it, I'm sure, but it's always a hindrance at times.
It is, and we think about, okay, we're going to set up that device, and this is how you use it, Mrs. Jones, and that's a wonderful thing, and we step away, and we can't do that. We need to go back, into the home or have that visit with the patient to go over that again, calibrate it if needed, make sure it's operating properly. This is really, really important. It's an ongoing educational experience for that patient, for them to be successful with that.
Where are we with acceptance with telemedicine?
We're getting better with that. However, we have a lot of work still to do with that. We talked a little bit about some of the issues like the physical disabilities. Patients may have economic inequalities are also a major component of that. But high rates of telemedicine unpreparedness or unreadiness is evident in unique Black, Hispanic populations, but also in rural areas and those with lower incomes as well as lower education tends to have bigger problems with acceptance and perceptions of what actually telemedicine is. There's a mistrust of technology as well. A national poll with the Healthy Aging states that 49% of older adults concerned about privacy and security when it comes to technology. Research out of the University of California in San Francisco indicates that nearly 13 million older adults in the United States do not feel ready to have a telemedicine visit. They did some research and some studies with that, and we think of Zoom, and most folks can jump on Zoom. It's not that big of a deal. But for older adults to be able to download that software onto their device, whatever that device may be that they're using, this became much more difficult for them to do.
Interesting. What are some of the opportunities of telemedicine for the elderly?
Telemedicine and remote patient monitoring have both really offer a lot and can really leverage our services to senior citizens. And we're not doing that yet today, but remote consultations, bringing that care into the home. Chronic disease management, leveraging remote patient monitoring devices to capture data, especially with devices like CGMs, continuous glucose monitoring. Other opportunities, medication management, mental health support, home health care, telerehabilitation, palliative care and pain care, health education and prevention. We're in the very early stages of really leveraging telemedicine for what it can be and how it could really support our efforts in bringing a patient to a better state.
As far as affordability, what are some of these devices that could be covered by our present-day insurances?
Our insurances will cover some of these devices at home. For the average person or patient, they go to your local drugstore, you can pick up some of these devices. We can test your oxygen. We can certainly get blood pressure cuffs we can buy, or the wrist, if you will. And a lot of these devices can be wireless and send that information to your smartphone. You can capture that data. You can look at that data over time. You can purchase them, and they're reasonably priced for the consumer, if you will, the average consumer. However, some of this stuff through insurance, some of it is covered and some of it's not. It depends on the insurance and actually what they'll actually cover. But that being said, they will cover some of this stuff.
Right. I would imagine our younger population right now are very apt to all this technology, and they're fitting right in with telemedicine and their telemedicine appointments. It'll be a smoother transition for them, but for our elderly population, it could be quite abrupt.
Yes.
So just acclimatizing to that is such a huge challenge to them. And
it is, and telemedicine is not the answer to everything. I mean, there are in-office visits that need to happen, and although we can take care of quite a bit with telemedicine, it's not the cure-all, okay? We need to understand that. It certainly has its place. It's kind of like we look at an email. It's good for maybe a paragraph. You're not going to write like 10 paragraphs in an email and nobody's going to read it. It has its place in society. I mean, that's a bit of a stretch of an example, but also when it comes to like even medications, before a physician can prescribe medications to a patient, there has to be a face-to-face visit. On-site visit, if you will. Mm-hmm. And then after that, for renewals, it's okay. They can actually do that. So there's different laws and stipulations when it comes to.
Do you think some of our elderly folks that have visual impairments and hearing impairments, does telemedicine fit for them? I mean, does it still have a place? Or what do you think of that?
It does have a place, and it has a place when you can, if someone's homebound and they have the vision impairment and mobility issues, it has its place because you can still do telemedicine. You just need to bring someone there, and it could be a community health worker, it could be a nurse, it could be a medical tech that's involved. And, for them to be there, the cost is a lot less than to bring a physician out there, yet they can handle some of those things. Maybe there needs to be some diagnostics done, maybe a blood draw, maybe we need to do a mobile x-ray or something. That can be done, by that tech or that person.
Right. You could always order home health and they could come out there.
Sure.
But, especially my patients and a lot of the geriatric department's patients, in their end of life stage. Mm-hmm. Telehealth has been so amazing because we could do multiple visits, family members there, we could counsel the family, and we could deal with the patient right there. And it seems like they don't have to get up. They don't. Some of these patients come to our clinic in a stretcher, and it's quite dramatic for them. It's a huge day of a preparation just to bring them in. So that really mitigates that. It really helps.
That's a whole other area, is to bring the physician and the healthcare providers and the healthcare team into the home to work with the patient. It's a beautiful example.
What are some of the technologies used in telemedicine, and how can they be helpful for the elderly population?
There is a lot going on in our world of health information technology, especially with remote patient monitoring devices, but we've talked about some of this stuff already. Evidence shows that we're shifting patients out of the hospital into the home with telemedicine. This benefits those, especially with chronic conditions. Remote vital signs monitoring coupled with in-home visits have patients doing better than those that are actually in the hospital. Patients are more active and care is actually cheaper. This is noted with elderly patients using expandable, wearable, and implantable devices, again, such as continuous glucose monitoring. Older adults prefer to be home and be independent. We all do. Dealing with health issues creates stress on the family. Passive technologies such as cameras and sensors, monitoring patients is much more ideal, if you will. Smart home technology using the Internet of Things or the Internet of Medical Things, and that's everything that's really connected to the Internet, if you will. But now we're talking medical things. This is the part of the data that's really interesting because it's kind of like that data sharing, information sharing. We're encroaching upon interoperability. This is a very, very exciting area. But this, coupled with wearables, allows elderly patients to be safely monitored remotely, thus, truly acute hospital care at the home, if you will. We also see virtual care centers bringing access to care in rural and underserved communities and areas using advanced monitoring technologies.
Yeah, I mean, just everything you said there, I could imagine that the clinician, but there's both goods and bads out of it. I don't think the clinician has a lot of information to begin with sometimes, so this is like an ancillary thing where you could get more information and you could capture something that could be critical or something acute. Like if their glucose, for example, skyrockets, and there might be a component of an active infection there, because their sugars have spiked, perhaps you can bring them in, or you could set up a telehealth appointment.
And that is truly exciting when you put a CGM on someone, a continuous glucose monitoring. You're monitoring that individual 24 hours a day, 7 days a week. Usually they're good for a few weeks at a time. That data, we didn't have access to all that data and information before. This really takes care for that individual on a totally different level because you have this information that wasn't there before. Before we had little snapshots, if you will, a Polaroid picture. What's my glucose level? There it is. Whatever it may be. But now we can monitor that. We can graph that out, and we can look for trends, and we can look for outliers. And this is very powerful information.
Right. The disadvantage of that, I would imagine, would be it could be a little superfluous for the clinicians involved. Checking every data spot on a blood pressure. That could be a little bit difficult for the clinician. I guess
this is where we can bring in, dare I say, and I didn't want to talk too much about AI today, but there we can bring in, artificial intelligence to start looking at that and building parameters and, not contacting the physician or the healthcare team unless it truly is. If we have an outlier, okay, but if we see a trend, then, we see at that point, then we can connect with healthcare provider to address that situation. And we're going to need that with all this information that we're actually capturing right now today.
That's very exciting. Yeah. Dr. Bronsburg, could you talk about some other benefits with telemedicine and telehealth as well?
Wonderful time saving. To spend an hour driving to an office and finding parking, maybe paying for parking, get up into the office suite where the physician is. Maybe you're sitting there for 10, 15 minutes. Okay, they see you, 10, 15 minutes, you come out, you're signing out and your insurance and all that. You get back into the car, another hour to get home. There's about 2.5 hours of idle time, if you will. If you can get back most of that time into your day, how powerful is that? Now, if the child was really sick and you had strep throat and you had to do a swab to be able to really make that diagnosis, that's a different story. So, it's not for everything, but it sure can cover quite a bit.
For the podcast audience, can you share what health professionals should know about telehealth and telemedicine?
Good question. There's much work to be done with telemedicine. We have yet to leverage these tools to their full capacity, especially with the efficiency and improving patient outcomes. Telemedicine allows healthcare professionals to evaluate, diagnose, and treat most patients. That, I think, is very important, and for healthcare professionals, we need to be able to incorporate this in their training at the classroom level, but also at the continuing medical education or continuing education level as well.
How would you advise the clinicians out there to say that maybe this particular visit that I'm going to see, Mr. X or Mrs. Y for is not appropriate for a telehealth visit, and rather they should come in? Because I'm sure there's some limitations with a physical exam as a clinician.
There is. And however, if you have a homebound individual and they need to have a physical exam for whatever reason, again, you can send that medical assistant out there who's been trained to do that, and they can actually do that and capture that information and bring it back, send it back to the office. So, that can happen. But yeah, as we've been saying, telemedicine is not the answer to everything, and we are going to have folks have to come in when they have certain conditions or issues where they need to see a physician.
It seems like everyone's all in on telehealth, but are the insurances all in for those telehealth online visits.
During COVID, they kicked in and they were paying parity. Whatever an office visit was, telemedicine visit was, and they were paying for that. After, things have subsided and they're not doing that across the United States. And it's really interesting because each state has a different way of actually working with their medical community and telemedicine and how they're reimbursing that and what's legal and what's not legal. There's so many still, we have those issues that are out there. Probably one of the bigger issues that probably rubs the states is when you have a physician in Florida and you have a patient in Georgia. Where does the billing come from and who the taxes and that becomes a big issue as well. So there's a lot of work still to be done at the legislative level, if you will, when it comes to telemedicine.
And Dr. Bronsburg, if you had one wish to make about telehealth and telemedicine in terms of research, clinical care, or education, what would it be?
We love the magic wish question, and that's an excellent question. When it comes to research, telemedicine, remote patient monitoring is really a growing area in our healthcare delivery system. Supporting this research is crucial because the payoff, the dividends on patient outcomes are really going to be a driving force in home care as we move forward. Regarding clinical care, telemedicine is a tool to bring access to care to meet the needs of our most vulnerable populations, including all seniors. Education, as I said, it's really important to include this training into our education of all health professionals, all the health professions training. To put this truly into perspective, when we think about COVID-19, which really forced us to find a tool to use to be able to really address the access needs out there, and telemedicine came to the rescue, if you will. That said, it really brought remote patient monitoring into the spotlight as well, because that was a major tool within telemedicine. This is really a part of the movement towards preventative care. So this is truly an exciting time for us in an exciting area of medicine.
And what can we expect in the future for telehealth and telemedicine for our senior population?
The future looks promising. According to the AMA, telemedicine will continue to evolve into a much more easier tool, if you will, to use. We'll move closer to like an all-in-one tool. It's going to be much more seamless than what we see today. We'll see telemedicine take on much more of an active role in chronic disease management. Reflecting back on some of the discussion that we had today with telemedicine, it's really proven to address some really crucial issues and concerns that have been nagging medicine for quite some time. The access to care, efficiencies, remote patient monitoring, data management. Seniors will reap the benefits of this convenience, the accessibility, management of chronic diseases, reduced healthcare costs, enhanced coordination of care, enhanced communication. We'll also see stuff like advances in technology constant. We'll also see new home-based care models, interdisciplinary care teams, and preventative care and aging will also take center stage.
Do you think there's going to be interprofessional teams with a telehealth visit?
Yes, most
Interesting.
definitely.
Yeah. You could bring everybody together in different locations, for that one patient. So
We can bring folks together from 4 corners of the United States to work with a patient in the middle of the United States, and the whole healthcare team is there. I mean, how novel is that to be able to take care of that patient with one visit?
Amazing. Yes. And where can the audience find more resources on this topic?
There's some wonderful resources out there. The first one I'll say is the American Telemedicine Association. We will post links to these as well. There's the Telehealth Resource Center. These are regional. There's 12 of them in the United States that you can tap into as well for information. The American Medical Association, the American Medical Informatics Association, the Health Information Management and Systems Society as well. And the last one I'll say is healthit.gov. And that is where the Office of the National Coordinator of Health Information Technology resides.
Thank you so much, Dr. Bronsburg. Thank you again, Dr. Bronsburg, for joining us today and sharing your expertise with our audience. It's been a pleasure having you do this discussion with us. Please stay tuned for upcoming topics from our renowned subject matter experts.